Hi, everybody. How y'all doing? Welcome. Good morning, good afternoon, good day, depending upon where you are. So it's my privilege to announce the first speaker today. His name is Daniel Fatori, and he is currently a postdoctoral researcher at the University of Sao Paulo Medical School, funded by the Sao Paulo Research Foundation. He earned his PhD in psychiatry from the University of Sao Paulo Medical School, where he studied the economic impact of childhood mental disorders. And then over the years, he's dedicated his time to studying clinical epidemiology, clinical trials, methods, data analysis, early childhood development, and maternal mental health. The title of his talk today is Maternal Parenting E-Diary in the context of a home visiting intervention for adolescent mothers in an urban deprived area of Sao Paulo, Brazil. His collaborator is Professor Guillaume Palanzik, also from the University of Sao Paulo Medical School. And just as a reminder, as we get started, to enter your questions in the Q&A, and I will try to facilitate those and get through all of those if we can. And yeah, and I'll handle that from there. Dr. Fatori, if you are ready, I invite you to take it away and to begin our conference. Thank you all for attending and looking forward to this talk.
Thank you. Thank you very much. And am I able to share my video?
I think Kevin, could you open up the video for?
Yes, he should be able to. Let me
Okay.
just.
Okay.
Just a moment. Yeah.
Because I was noticing that on my end too.
Yeah, you should be able to just do that. Apologize. Just a moment.
I understand why you'd want to stop my video, but
so Daniel, are you unable to share your screen? I'm sorry.
No, I wasn't allowed to.
Looks like
I cannot start screen sharing while the other participant is sharing. That's the error message.
Okay, got it. Okay, go ahead and take it away.
I still can share my video. Is that all right?
Yes.
Yes, please. Yeah, please, if you're able, go for it.
No, I can't. You cannot start your video because the host has stopped it.
No. I can see your screen fine.
Uh-huh. I can do this without the video if it's all right.
I'm working to see if there's a setting that I'm not noticing. I apologize. Well, you should have all the permission you need to do what you need to do. So I'm not, I will keep looking, but if you can proceed, that would be probably good.
Okay, yeah, fine. So thanks for inviting me, and I also would like to thank everyone that is present here, studying, trying to learn something new, watching some lectures during these very tough times. I will be presenting a study that we conducted here in Brazil using a smartphone application to measure parenting skill behaviors. So first, I would like to put some context regarding the study that we conducted. So here in Brazil, we have some very important public health issues. One of them is that we have very high rates of preterm birth, also very high rates of low birth weight. And more specifically, we have a very, very high birth weight per 1,000 adolescents. Our rate is even higher than similar countries with similar income, and also much higher than well-developed countries like the US, and we are not getting that much better throughout the years. And this is important because maternal adolescent pregnancy is related to a series of adverse outcomes regarding not only the mother, but also the child. So with this context, we decided to develop an intervention to promote maternal health and also to promote child development. So this is the context of the study that I'm going to show. So the intervention that we developed is called Primeiros Laços. Loosely translated to English, it would be something like First Bonds. This is a partnership between the University of São Paulo Medical School and the University of São Paulo School of Nursing. So the intervention, I won't go into much details, but basically it's focused on these 4 domains. We want to get these very young mothers to have their prenatal care, an adequate prenatal care, and adequate nutrition, hygiene. We also, the nurses talk a lot about vaccination, prevention of accidents. They also help them identify resources like social support, housing, daycare, school, access to health services. And most of these adolescent girls, they will interrupt their life plans. Most of them will not continue to study. They won't go to college. They will eventually have a very low income throughout their lives. So one of the ideas of the intervention is to help them get back to studying, eventually go to college and find a good job for them. And the main focus is parenting skills after the child is born. The nurses talk a lot about parenting skills and behaviors and how to stimulate the child throughout the first 2 years of life of the child. So for the purpose of these presentations, the objective is to test the impact of this nurse home visiting program, the Primeiros Laços program for adolescent mothers on parenting behaviors measured by an e-diary. So I'll talk about the methods now. So this all happened in the context of a randomized controlled clinical trial to test the intervention that I mentioned. These are the inclusion criteria. These are all adolescent girls in their first pregnancy, living in a specific region of São Paulo with very low socioeconomic status. Our sample size was 100 participants, and the sample size calculation was based on the impact of the intervention on brain-child development. So I believe most people here are not from Brazil. So to put in context, in your left, you have where the city of São Paulo is, considering the whole huge country that is Brazil. On your right, you have the state of São Paulo and the city of São Paulo map from Google Maps. And this is a huge city with more than 12 million people. And it's our country is very unequal, and São Paulo is a very good example of that. We have a lot of rich people, but also a lot of very, very poor people. So this is just the approximate location of study participants in the city of São Paulo. In the middle, there's this orange icon. This is where our Institute of Psychiatry is, and the blue icons are the participants. So to give a little bit more context, this is an example of the region that our study was happening. This region is very heterogeneous. In fact, there are a lot of rich neighborhoods, but also a lot of very poor neighborhoods, as you can see from the photos. These are the so-called favelas, slum areas. In the left, you can see a very structured favela, probably that started developing decades ago. On your right, there's a more recent favela with not so with a not so good structure. So this is an example of where the participants of the studies were living. So this is this puts the study in context. Okay. Regarding the whole study from baseline up to 24 months of the child's age, this study that I'm going to present today happened at 18 months of the child age, where the eDiary study took place. And we used generalized estimating equations models to verify the impact of the intervention on the measures that I'm going to show. Intervention and time were covered in all the models. So the electronic daily diary that we used with the LifeData platform happened at 18 months, like I said. And it was a protocol for 7 consecutive days. The mother, the participant, was notified 1 time per day during the night to report about maternal well-being and mother-child interaction that happened throughout the day. We were able to contact 57 participants that were enrolled at baseline on the clinical trial. And at least 48 participants responded at least one day of the maternal eDiary. So these are the measures that we used in the study. We used a couple of measures more, but for the purpose of this study right now, I will show the results regarding these ones. So we measured general well-being. So this is just the idea of the well-being during the day, the general well-being. And we also measured parenting well-being. So how well the mother felt about taking care of the child, and also time spent with the child in hours and minutes during the day. And we also measure, like I said, parenting skill behaviors, like some of these examples here: taking care of the child, reading or showing a book, telling stories, going out, playing, talking to the child. So these were all yes or no questions, followed by how much time they spent in each of these behaviors. But I will only show the measures, the binary variables, because we had some issues with how the participants measured time in each specific activities. I can talk more about that later if someone is interested. So here are the results. The first table here is just to show that our clinical trial at baseline was very well balanced. The only variable that was marginally unbalanced was the presence of family food insecurity, but it was not statistically significant. And as you can see from this whole table, these are very vulnerable families living in adverse conditions. So we have low educational level. We have a lot of participants that are illiterate. They are not working, and 26% are enrolled in social welfare programs like the Bolsa Família, a conditional cash transfer program here in Brazil. And more specifically, table 2 talks about the sample characteristics at the time of the specific study that I'm talking about right now, the eDiary study at 18 months of child's age. And we didn't find any major imbalancement here. Also, comparing the included sample in the analysis and lost to follow-up sample, no p-values were statistically significant. But some of these variables have very low numbers, so some of them it's difficult to conclude anything more specific. So this first figure talks about the eDiary compliance rate per day during the whole study. Like I said, 84% responded at least one day. And I mean 84% of the mothers of the participants we were able to contact, not the original 80 participants. And the compliance ranged from around 65% to around 50% at day 7. So now I will show the main results of our analysis. So here you have some graphics showing the mother well-being. Like I said, this is the general well-being during the study. And in your top right, the parenting well-being, we were able to find an effect of the intervention on parenting well-being. It's not a huge effect, a very small effect. And we didn't find any effect on total time spent with the child, comparing control and intervention. Oh, I forgot to mention that the control group is treatment as usual. It's just prenatal care and postnatal care done by the public health system here in Brazil. So no intervention whatsoever. We just assess these women. And here are the parenting skills measures throughout the study. So we found just one specific effect, the variable mother telling stories or singing to the child. All the other variables, we didn't find any difference between control and intervention. So just to put some context here, the y-axis are predictive probabilities. Like I said, these are binary variables, if the behavior happened or not during each specific day. And the x-axis is the specific time of the study. So these are all derived from the generalized estimating equations models that I mentioned before, that are quite robust to analyze longitudinal data and are able to deal with missing data like we had in our study. So yeah, these were the results. So some thoughts regarding our results and our study. Our findings are very difficult to compare, not only because this is the first study using our smartphone application in Brazil in this type of context regarding mother-child interaction, early childhood development, and very low-income participants. And also because we don't have a lot of studies here in Brazil that try to measure these constructs in any other way. The field of early childhood development here in Brazil, it's quite young, I would say, not well developed up to this moment. So what I would like to say is that probably most people here are already reading much more complex studies using experience sampling, IDARI, ecological momentary assessment with many more time points, more measures per day, sometimes even more than 1 month, some studies going to up to 1 year. Our study here was very simple because, like I said, this is the first study in this type of population, in this population. So we were very uncertain of trying to do too much or putting too much burden on participants. And we were also very unsure on how well the participants would receive this type of measure, if they were able to, if they could be install the app, if they had smartphones, if they were able to understand the questions and respond accordingly. So we were very unsure about all these questions. So we decided to do something more simple, just 7 days, 1 measure per day, to understand first what could be done. So yeah, so basically that, and we are quite pleased about our results, especially regarding the compliance rate. So we are now very encouraged to do more studies like this. We are already planning a second one because we started a new clinical trial testing the same intervention with much more bigger sample. So we're probably trying to do a similar study, but more measurements, more measurements throughout time. Probably one idea is to break down the parenting skills in more specific behaviors, because we found some ceiling effects in some of the variables, mothers reporting very high frequencies of these behaviors. That's why probably we define differences between intervention and control. And of course, we have a lot of limitations here. The sample size is one. The original clinical trial was not very large, and because of loss to follow-up, the sample size was much smaller than we would like. And these results should be taken with a grain of salt, because these are secondary outcomes of an RCT. And I would like to come forward to say that this study was not planned from the start. This clinical trial had different primary and secondary outcomes from the start. So during the clinical trial, we came up with this idea and found a way to fund this study. And then we added this new secondary outcome. So it was not planned from the start, but at the same time, it's not like we are hacking or something. It was more of an idea to test waters and see if these kind of measures are able to be done in this kind of context. And also we don't have a lack of construct validity because of the small sample. We couldn't use statistical techniques like CFA and growth curves to measure how well these constructs are being measured. Specifically in the case of growth curves, all models would not converge because the sample size was too small. And some of the variables, like I said, we had a seeding effect, so you don't have a lot of variability, so it's difficult to convert. So to conclude, like I said, we were very pleased with the results. So future early childhood development intervention studies could use this kind of measures, smartphone applications to measure mother and child behaviors. This is specifically important because in the field of ECD, measures are usually very expensive, and also you usually need someone very well trained with a very solid background in child development. So it's costly and it's very time consuming. If you are able to translate these very costly measures into smartphone applications that are very robust and have validity, it would be very good, especially in low and middle income countries such as Brazil. And like I mentioned before, one idea is to do more frequent assessments to further enhance temporal and ecological validity. So I would like to thank everyone again for being present here in this virtual conference. I also would like to thank the various companies and institutes and agencies that funded our project, and a special thanks to my supervisor, Professor Guilherme Polanzik. So yeah, that's it.
Great. Thank you, Dr. Fatori. Yeah, thank you. So it's great seeing experience sampling and need diary used widely in low income, middle income demographics like this. Appreciate your work. We have a number of good questions. The first one here is says interesting study. Could you please elaborate a little on the decision to use EEG alpha waves as a primary outcome measure? What was it an indicator of? Stress?
Yeah, sure. Our study, we did this study with a partnership with Professor Charles Nelson from Harvard. He's the main investigator in a very well-known study that they assessed Romanian children. So we basically replicated the measure that he used in his very famous study. So the idea of using EEG is that because first of all, it's very feasible to do in this very young children. And also because it's an indicator of child brain maturation. So that's basically it. It's child brain maturation, not specifically stress, even though we have some other measures of stress like maternal cortisol and child cortisol.
Great, thank you. So the next question is, can you provide some information about the statistical approach and why you selected it?
Sure, yeah. Generalized estimating equations, it's a very interesting statistical technique. It's a semi-parametric test. So you can model, oh, I have my camera now, so thank you.
Yeah.
So you are able to model various types of distributions, like the binomial distribution, Gaussian distribution, Poisson distribution. So it's very flexible. It's designed to analyze longitudinal data up to how many time points that you want to analyze. And one very strong point is that the GE can model missing data. So you don't have to impute missing data beforehand. You don't have to use statistical techniques like imputation, multiple imputation by shaded equations. You can just insert all your subjects in the model, and he will deal with missing data if you have at least one measure of the subject. So yeah, it's a very interesting modeling technique. I suggest you use it in your studies and study it.
Great, thank you. So the next question is about compliance rate. Was it higher, lower, about the same between the control and your intervention group? Wondering how much impact you think the intervention had on compliance, and if diary completions had any impact on this.
Yeah.
Actually, if I can add real quick, I kind of
Yeah,
had a similar question, is about reactivity. So the effect of even in the control group being asked these questions repeatedly. Any thoughts about maybe that actually starts to shift their awareness and change in behavior as well?
Mm-hmm. Yeah, regarding differences between intervention and control, we didn't find much difference. And the nurses that were conducting the intervention, they didn't talk about this study specifically or the smartphone app, and they were not encouraged to do that. But yeah, I don't think the intervention had any specific effects on the compliance diary completions. And regarding what you said, yeah, that could have happened. It's difficult to be certain of that, but it's the Hawthorne effect, right? You are asking people something, you are studying a specific topic, so you are basically encouraging them to think more about it. But yeah, that could have happened, but it's difficult to know for sure.
Yeah, might be an interesting thing to look at, of whether or not the asking them this repeatedly actually is a part of the intervention.
Yeah, but one thing I would like to say is that these type of behaviors, they are very, very difficult to change. You know, yeah. So we have in the literature interventions that can go up to 2 years, one visit per week, and still you found a very small effect on these types of behaviors related to early childhood stimulation. So that's one thing. If we were able to change this sort of behavior just because of a frequent assessment, that would be huge. Yeah.
Thanks. The next one, and you touched on this a little bit at the end, but a little more detail on how much access did participants already have to smartphones, you know, since this low income demographic. Were they using their own phones? Did you need to lend them phones? What their familiarity was with smartphone usage in their own life? And then also just being able to, how you onboarded them, I think is the general question, and whether they're using their own devices or not.
Yeah, this is a very, very interesting question. At baseline, we had information that almost 100% of the participants had a smartphone. So that's why we were encouraged to do this study. But when the study was, when we contacted the mothers, we discovered that some of them didn't have phones anymore. So to put in context, smartphones in Brazil are very, very popular. Even though some people are very poor, they somehow are able to have like an old Android smartphone. So it's not that difficult. And we also here in Brazil, it's very common to have some knockoffs, you know, some not official smartphones, or people usually sell very old smartphones. So most people here have smartphones. WhatsApp in Brazil is huge. It's very, very huge. It's the main way of communication. So it's very common to find people in favelas that have smartphones, even though they don't have internet. Most of the time they use random wireless connections that they found in the city. So responding to your question, we had around 15 participants that didn't have a smartphone, but we lend a smartphone to them for the period of the study, and then they returned the smartphone at the end of the study. And I also analyzed if we had some differences between measures and compliance because we did this, and I didn't find any difference. This is reported in the paper that we published.
Okay. Thanks. Yeah, that's encouraging. Yeah, it's nice to see demographics that may not typically be studied this way. So appreciate that. So if there's any other questions, we'll probably have time for maybe one more. There's one more I have here. You mentioned that this one says, thanks for the study. You mentioned the possibility of more frequent assessments there in the end in your discussions. But what are your thoughts about the trade-offs in terms of participant demands, response fatigue, and those factors? You see that as a problem?
Yeah, that's a very interesting question also. Yeah, it's very difficult to answer. In fact, it would be, we can't predict that, how well the participants will respond. But yeah, I think if we do try to do too much, it will probably be a problem. Almost certainly will be a problem. I'm thinking about maybe try to do something for 1 month, not every day, and also try to do more than one measure per day. Also, because I'm very interested in studying mental health symptoms. We didn't do that in this study, but we've been studying a lot about affect dynamics, depression dynamics throughout time. I have a colleague that is studying some math models to study that. So I would like to do that in a sample similar to this one. So yeah, I probably go up to 1 month, and most certainly not consecutive days.
Okay, great. Well, thank you so much. Appreciate you kicking us off, Dr. Fatori. Thank you for your interesting study and sharing what you're learning there in Sao Paulo, Brazil. It's nice connecting with you. I'm going to talk to Zoom about having a virtual clap. That would be nice to do a virtual clap when people are silent at the end of a study. So I appreciate you kicking us off. Have a good rest of your day, and